Hello, I'm Dr. Nick Sotelo. I'm going to give you some of my views on EMDR. EMDR stands for eye movement desensitization reprocessing. EMDR. So you're going to use eye movement to desensitize the trauma experience, and then you're going to reprocess it. You're going to reprocess the trauma experience. So it's focused on trauma. EMDR has been around, I think, since the 90s, I think is when it was developed. And I've lost my memory for the person who did develop it. I was introduced to EMDR in graduate school, and that would have been in the early 2000s. And I had a no nonsense department chair in my training in clinical mental health counseling. She was a German lady named Dr. Karen Jordan, and she came to class one day as a just to give a guest lecture on EMDR. And so for me, in that moment, in that context, if Dr. Jordan said that there was value and validity to EMDR, that's all I needed to hear, because she was a no nonsense lady. And I'll quickly share her story. Her story is that she was interested in EMDR and had learned about it, and had noticed in herself that she had an aversion to the color yellow, had no idea what it was about. And so she decided to use that as the prompt, the thing to explore in EMDR, and had, through the process, and I'll describe the process as I know it here in a second, but through the process of Dr. Jordan receiving EMDR, she had some mental pictures came up in her mind from her childhood. She remembered being with a sister and being with a friend, either of the family or in the neighborhood that she lived in, that was older, and they would walk to school back and forth. So that was the mental image that came to mind. So Dr. Jordan then is at home, with family members at one point in time, maybe for the holidays. I don't remember the story exactly, and starts sharing some of this experience with her family members. And somebody in her family says, "Well, don't you remember?" And Dr. Jordan says, "Remember what?" She said, "Well, one day when you were walking home from school, and you were walking by the edge of a construction site, and part of the equipment, I think it was the bucket or something, had fallen off and had landed close to this group of girls that were walking, and it clipped one of them. One of them had gotten hurt. They didn't die or anything like that, but definitely there was a construction site accident while they were walking by the construction site, and it caused some damage and harm to one of them. It wasn't Dr. Jordan, but it was the construction equipment is typically colored what color? Yellow, right? And so that's where Dr. Jordan made the connection that yellow and that's the reason why she had some noticeable aversion to the color yellow. And through the EMDR process, she was able to make the link. Okay, so that's the story that I was initially told as a young clinician in my training phase, and so I've always had an appreciation for EMDR since that point. Now, here are some of my overall thoughts, and let me explain EMDR just as quickly as I can. So it's the idea that when you have a traumatic experience, something in your life where you are exposed to either kind of moderate traumatic experiences over time. We call that complex trauma. Sometimes it gets called little t trauma, but I don't really ascribe to that for reasons that are beyond this video. Or you can have a big T trauma. That's when, if you're in combat and you're deployed, obviously you're seeing all kinds of things. You're having your own life threatened. So that's a big T trauma. It can come from car wrecks, a lot of different, being assaulted, domestic violence, child abuse. Those are all things that can cause big T traumas. But the idea is that trauma, when it becomes pathological, where it becomes symptoms that don't fade over a certain period of time, usually 6 months, then that becomes diagnosable, right? PTSD. It's the idea that that trauma experience is locked in one part of your brain, and that you need to be able to process it across both parts, both hemispheres of your brain, in order to unlock it, and then to be able to re-experience, reprocess, and redefine. That's usually the broad brush approach to helping somebody with trauma or a PTSD diagnosis. Re-experience, reprocess, redefine is the arc for treatment in things related to trauma and PTSD. So what does EMDR do? EMDR is providing an avenue for what we call bilateral stimulation, right? So bilateral hemisphere of the brains. If it's that theory is true, that trauma is locked in one side of your brain, then doing something like eye movement, right? Because we know that this eye is connected to this side of the brain and vice versa. This eye is connected to this side of the brain. So when we do eye movement, then we are creating bilateral stimulation. Okay, so that's one way that you can do it. Sometimes your clinician will have a light bar and the light will go back and forth, and so you follow the light on that. Or sometimes they can teach you to tap. You can tap on your shoulders, you can tap in your hands. Sometimes they'll have a device that will hold in your hands that will pulse. And then while that stimulation is happening, the bilateral stimulation is happening, you are then encouraged to talk about whatever the traumatic event is. That's the re-experience. Right? So you're going to re-experience the traumatic event while the bilateral stimulation is going on, right? While the things in your hands are pulsing. And again, the idea is that it's unlocking it from the part of your brain where it's stuck, and so it can be processed across both hemispheres of the brain. So that's the theory of how and why EMDR works. So here are some of my thoughts. Number one, I think that there is evidence for it. I think that is it gets claimed as being an evidence-based intervention. I think that there is, research that would support that. My biggest concern about EMDR is people can get trained via the workshop model. And I have lots of concerns about the workshop model. When I'm supervising somebody, I will forbid them from engaging in the workshop model. And if they do, then they have to find somebody else for supervision. I caution all of my students to not do the workshop model for EMDR. Why? Because the workshop model usually happens across 1, 2, or 3 weekends where you're giving, 8 hours, 16 hours, 24 hours in total training to learn EMDR. And in the process of this workshop model, these people are being told to go try it out on family members. Go try it out on some of your clients if you're actively seeing clients. With this idea that you can pre-know when you're trying it out, that you can try it out on something that is not that big of a deal. And you just cannot know that. Remember Dr. Jordan's example that I just gave, the color yellow was the aversion, the not that big of a deal. Well, it was actually linked to a fairly traumatic event where a piece of construction equipment fell and hurt one of the people that she was walking with, right? So color yellow, I don't really like it. I don't know what it is. I don't like Runts candy because it's yellow. I don't like bananas, right? It doesn't seem like a big deal. Well, in her case, it was linked to a near life and death scenario. So that's one of the reasons why I do not like the workshop model, is because it's just set up for failure from the get-go. The true training model is you go in and you have extensive training, and there's at least 3 phases of the training, and that when you're using the EMDR intervention, you're using it under supervision, meaning that it's in the context of working directly with an EMDR trained supervisor, and you're going to be seeing your clients with that supervisor within close reach or range. And there are stories of people receiving EMDR and they decompensate, which means that they lose control of their psychological and emotional faculties, and they are not well to leave the session. And so you have to work a whole process to get this person restored in order to be able to safely leave the session and return to their everyday life, right? And so if you're going to be seeking out EMDR therapy, you need to be asking about how the person was trained. Just ask them, what was your training process like? And you should be able to hear pretty quickly, oh, I went to this workshop, and and then if you hear workshop or if you hear training, ask them how long the training was. And if they say a couple weekends, that's a red flag. I would honestly encourage you to go find somebody else for that EMDR intervention. Again, you want somebody that's gone through the phase process where they had direct supervision. It's going to cost some money, right? The workshop model, it's appealing because it'll cost anywhere between $200 to $600. The full-fledged training is going to cost in the thousands, and it's going to take a time commitment of 6 months, 9 months, a year and a half. I'm fuzzy on those timelines because I haven't looked at it recently to know exactly what the parameters are for the full training. But hopefully you get the idea. Workshop model versus the immersion training. You want somebody that's had the immersion training in EMDR. So the other side of this question is, what can somebody do to support somebody who is going to be embarking on EMDR? And I think it's just recognizing that things are going to be shaken up for them, right? Again, EMDR, they're going to be asked to re-experience the trauma. And you can't know on the front end how unsettling that might be for the person. And it may be unsettling to a certain degree within the clinical office with the therapist. And then coming away from that and coming home, they may have a different experience. The unsettling process may look different at home than it is in the office. So, hopefully that therapist is helping them to gauge, how they're doing psychologically and emotionally before they're leaving the session. But again, that all depends on how that therapist was trained. So what can you do to support somebody who's going through EMDR? Give them some space. Don't expect it to be a quick fix process. True EMDR is going to happen over the course of, I won't say weeks, but I'll say months. And, there are going to be some peaks and valleys with it, right? And, with trauma, whether it's, unconscious, or you're consciously aware of your trauma triggers and you're trying to establish barriers in your everyday life to avoid them. Well, EMDR is going to ask that you don't avoid the triggers anymore, right? Because that's how you have to re-experience, reprocess, and then redefine. So, if the EMDR work is being delivered the way it should, the person's going to be shooken up a little bit. But you have to shake it up a little bit on the front end in order to do the processing it. So give them some space, understand that it's not going to happen on a quick timeline, and just let them know that you're going to have to cut them some slack, is what I'm going to say too, right? Is, if they're a little bit more on edge, a little bit more irritable, I would expect that. I would definitely expect that. But just support them for being willing to take the steps to do the work necessary to heal and to get past this. And in the constant context of a relationship or a parent-child relationship, I would guess that part of their motivation for doing that is to improve those relationships. So if it does seem like it's getting a little bit worse before it gets better, that's usually part of the deal. But just hang on to this notion that they're doing it for the overall good, right? So if there's specific questions that you have about what EMDR is or isn't and how to support somebody, just ask me. You can leave a comment on this video post, and I'll be happy to respond to it. So I'll sign off for now. This is Dr. Nick Sotelo, and this was a short overview of EMDR, what it is, what to look for in somebody who's trained in delivering it, and how you can support somebody in your world that's going through EMDR therapy.